I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I wanted to talk to you a few minutes about chin augmentation. Enhancement of one's chin can be a wonderful addition to improving one's facial appearance and profile. We in plastic surgery see many patients for improvement in the chin neck area, and most commonly this is done with a chin implant. In determining whether one is a candidate for chin augmentation, this is usually done in consultation with your plastic surgeon and is done via digital imaging or with a simple photograph. In a profile view, one can drop a line down from the junction of the forehead and nose in a vertical fashion and determine where the chin sits relative to that line. If one's chin sits behind that line, one probably is going to be a good candidate for chin enhancement. As the chin comes forward and either hits this line or goes slightly beyond that line, that throws the whole face into better balance as one enhances the chin, nose, and forehead areas to bring the overall face into a better proportion. Chin enhancement is really done two ways. By far and away, the most common method is through an implant. Implants are generally placed through a small incision underneath the chin area about 1 inch in size. This provides direct access to the bone. The muscle is lifted up and a chin implant of the appropriate size is put in. There are many different styles and sizes of chin implants. The size of the chin implant, or the amount that the chin is going to be brought forward, is really determined by that picture. How many millimeters one chin sits behind that vertical line that we previously talked about will determine the thickness or the size of the implant. There are different styles, and the most popular style of chin implant is going to be what we call the anatomic or the extended chin implant. This is where the wings or the sides of the chin implant goes back against the jawbone and helps create a much more natural transition into the surrounding bone, as opposed to just having a chin button which sits right on the end of the chin, which can look very unnatural. So I personally prefer the anatomic or the extended chin implant style. This is a very simple operation that takes less than an hour to do under general or IV sedation anesthesia. The results are immediate. There will be some swelling. Generally there is no bruising. The chin and the lower lip area are going to remain a little stiff for a week or two, but the immediate change to your profile is quite apparent. There really is no other recovery other than a little bit of social recovery, having some swelling in the chin area. Be aware there is another area to improve your chin, and that's called an osteotomy, or actually moving the very end of the bone known as the chin bone or the symphysis forward. I use that in those cases where the chin deficiency is very great, where the actual jaw is short and one actually has a bad bite or a malocclusion. There are those patients who are older that do not want to go through the whole process of bringing the jaw forward, even though they recognize that their underlying jaw is quite deficient in growth. In those cases, you can simply move the bone forward and hold it with a plate and screw. This is a little bit more of a bigger operation with some more swelling and generally some numbness of the lip and chin for a while. But I think those patients who would otherwise require a very large implant, and particularly in those patients who are younger, are going to benefit by moving the bone long term. It's a little bit more of an effort early on, but the long-term benefits of that are much better than having a very large implant in one's chin over a long lifetime in a young patient. So even though a chin osteotomy is one method, it is reserved for those special patients who generally have big chin deficiencies and are much younger in age. Again, a chin implant is by far and away the most common method that is done. These are some thoughts for you on chin enhancement or chin augmentation. I wish you the best of luck in your chin surgery. I'm Dr. Barry Eppley, plastic surgeon of Indianapolis.